All right, team, good morning.
Morning.
Nice to see you all today. So we just wanted to meet today to do a discharge planning meeting for Marta Jones on the third floor. I met with her daughter the other day, and she let us know that she really wants to get mom home.
Okay.
And we need to figure out what we need to do to ensure that her discharge plan is successful for them. One of the things, or a few things that we need to really talk about is what services she'll need at home. If there's any teaching that needs to be done, what that looks like, and also any supplies that she might need at home. Okay?
Sounds good.
So to get us started, Nurse Nicole, can you just give us a synopsis of Marta while she's here?
Yeah, so Marta's an 80-year-old female. She has a history of CHF and COPD. She was admitted on 10/5, so she's been here for quite some time now. She's had a stage 4 pressure ulcer, which has healed with the wound vac. But I know I know you all have been really concerned about her skin integrity.
Yes, yes.
So, I know the family really wants to get her home, and I've seen them come in every day. But I do have a lot of concerns. I think my biggest concern is that she's on oxygen, which is new. So that will need to be set up, and then, family will need to know how to sort of run that at home. And then she still has the G tube, and I think the plan is to send her home with the G tube.
I believe so, yes.
Okay.
Yeah.
Okay.
And so they'll need, teaching around the kangaroo pump and so forth. And then I know we sort of talked about some physical therapy stuff.
Yes, yeah. So the family, so she lives with her daughter and her son,
yeah,
right?
Yeah.
So I believe those are the family members that I've been interacting with, that sometimes are in the room when I'm there. And they do tend to visit a lot. However, I try to teach them a little bit about how to use the lift, how to turn her, to prevent any future skin injuries, and kind of showing the importance of mobility and doing passive exercises. And they're very nice, and they're very involved overall with their mom, but they don't seem to be very interested or really eager, or maybe they just don't understand the importance of these interventions. But I'm not sure how much they'll be able to be involved or willing to be involved once she's there. And that's when I think that there's a potential of just her condition deteriorating and her coming back.
Just to get a little bit of clarity around a couple of things, you said that her oxygen is new for her. Do you know if we've tried to wean her off the oxygen in the past?
Yeah, I was just looking. It looks like every time we've tried to wean her, we have been unable to.
Okay.
So I think this is sort of, and especially with the COPD, I think it's sort of, she's at that stage now where she'll need it.
Okay. Yeah. And Katie, can you tell me a little bit more about her transfers out of bed? So she uses a Hoyer, right?
Yes.
And does she get up to a wheelchair, or is she bed bound?
No,
most of the day?
She's bed bound. So she can be hoyered out to the chair.
Okay.
And then she can be turned. She's a 2 times assist for any turns.
Okay.
But she requires help with pretty much all the ADLs, and she doesn't. She needs a Hoyer for any out of bed.
So 2 assist for the Hoyer transfer.
Yes.
Is it a 1 assist or 2 assist for her ADL care, the actual bathing and dressing?
For bathing, it depends. If it's like a full bath, she does need 2 people to turn her.
Okay.
But if it's just like doing passive range of motion exercises or feeding or doing just mouth care, it's just 1 person.
Okay. And Nicole, can you tell me a little bit more? Do we provide incontinent care, or does she have a Foley that the patient's family would need to manage at home?
So we were able to take out the Foley, so now she has a pure Wiccan.
Okay.
So we'll also have to have the family learn sort of how to work with that.
Okay.
And then one other thing that I forgot to mention earlier was her Lovenox shot.
Okay.
So I tried to do, Marta's first language is Polish, and as well as the son and daughter, which they are able to communicate fairly well in English. But I didn't have them, of course, give the injection, but they seemed really hesitant and sort of worried about doing that part. So I think that's another barrier that I just wanted to throw in would be, teaching family members how to give the Lovenox injection.
Okay. And in terms of her G-tube, is she taking anything by mouth, or she's getting all her nutrition via the G-tube?
Everything through the G-tube, yeah.
Okay,
meds.
so they would need to learn how to do that.
Yes.
Okay.
Yep.
Okay. So when I last spoke to Marta's daughter and son, I think they're here every day, right?
I see them pretty much every time I work with her, and I usually work with her,
Okay.
Monday through Friday, yeah.
Okay. So in our initial meeting, when I first met with them, they had shared that they were doing a little bit of assist at home, but it sounds like Marta is more dependent now than when she was at home before her admission to the hospital. I tried to talk to Marta again, like the language barrier. It was a barrier. I couldn't get a sense if her cognitive defects were the reason why she couldn't tell me what was happening in the home. It sounds like they did not have any services at home, meaning nursing assistant to help them with the home care or meals on wheels at home. So it sounds like, based on the information that you've given me, that we would need to consider some sort of home care services, right?
Yeah, I think so.
Okay.
Yeah, I think that would be good, because I'm just not sure how much the family is, able to learn and then do effectively, And I'm worried with PureWick too, because I know even some nurses have problems setting it up correctly so it doesn't leak. It tends to have leaks.
Yes.
And with her skin integrity, if that PureWick doesn't work well and it's not checked.
That's a great point.
Okay, so they'll probably need a PureWick at home. So I'd have to figure out what vendor would be able to supply that at home, right? Okay. So it looks like when I last sent an update to the insurance company, let me see here. So they're talking about wanting an update on February 5th. I had let them know that the family was looking to take Marta home, and they said if that was the case, they would consider a last cover day of 2/12 in the facility, with a potential discharge date of 2/13.
Okay.
Now, keeping that in mind,
What's today's date again?
It's January 30th.
Okay.
So
yeah.
We don't have much time.
We don't have much time.
Yeah.
So, sort of reflecting on those targets, Nicole, can you tell me exactly, in terms of nursing and medical, what are the key things that we would need to teach Marta's family?
Yes. So I think definitely oxygen management first.
Okay.
And then some education around the G-tube.
Okay.
How to crush meds, how to administer those, any problems that might happen with the G-tube.
Okay.
The Lovenox injections, and then sort of ADLs.
Okay.
PureWick, out of bed, things like that. I would say sort of those are my top priorities.
Okay. And Katie, from a PT standpoint, what education will the family need?
Yeah, so piggybacking on the ADL, so definitely how to use a lift, a Hoyer lift, how to get her out of bed, how to position her to minimize any pressure points, how to do passive range of motion exercises, how to check her for skin integrity, any pressure injuries, and I think those will be the key ones from the PT perspective.
Okay, okay, that's good. Again, keeping in mind that we have between now and potentially the 12th, right? Do you think you'll be able to set up some time with the family while they're here, since they visit every day, to start the teaching?
Yes, I think having an in-person interpreter at the bedside
Okay.
Versus, having the video would be best for this.
Okay.
So I will, I'll call interpreter services and try to have an in-person Polish interpreter.
Okay. Let me know if you have difficulties with that. I do
Okay.
have another resource that we can use, okay?
Perfect.
What about you, Katie? Do you think you'll be able to work with Nicole and maybe kind of piggyback the sessions
Yes.
with the family?
Yes, for sure. Yeah, I can
Okay.
definitely work around your schedule. I can just set up my other appointments around
Okay.
that whenever it's convenient for the family. So just let me know.
Okay.
Okay.
Yeah. And I believe, I know that I think both the son and the daughters smoke, just so you know.
Oh.
So just
Okay.
like, since she's not going to have oxygen, it's just something to think
Yeah.
about, for education, and also if there is any, maybe it's a good opportunity to ask if they would be interested in.
Yeah, smoking cessation.
yes.
Okay, that's a good. I didn't know that, so thank you.
Okay. And also, I did have one question from therapy. I know when I last spoke to, I forget, I think it was Mike who had it last week for PT. He did tell me that he provided the family with a home evaluation paperwork, because I believe Marta, before she went to the hospital, her bedroom was on the second floor of the home, and he had mentioned to me that, if there's a potential of her going home, she would need to come to the first floor.
Right.
Do you know if the family gave you back the paperwork from the home eval?
They didn't give it back to me. No.
Okay.
So I'm not sure. I can follow up on that. with
Yeah,
them.
so
Yeah.
we will need to make sure that we get that, so
Okay.
that we know,
Okay.
like where the bed will go.
Okay.
I think you said she was dependent for toileting, right? So I don't think she'll
Yeah.
need to use the bathroom at home. Okay, so that's a good plan.
And do we know for sure that they do have a bedroom on the first floor? It's just a matter
Yes,
of moving
yes,
her? Okay.
they do.
Okay.
They do. So I think the plan would be, if she was to go home, that they would need to move that
Yes.
room to
Okay.
the first floor.
Yes.
Okay, great. So I just want to recap what we've spoken about and what our takeaways are for Sally. Okay, so what we have here is that, Nicole, you and your team will complete the family training on medications, daily care, the PureWick, the G-tube, and the oxygen, right? Katie, you and your team will provide caregiving education on assistance, transfers using the Hoya, right?
Correct.
And then follow up with the family about that home evaluation
Yes.
paperwork. That's very key,
Okay.
because we want to ensure that the space that she's going to is safe for her, okay? On my end, I will make sure that I provide vendor information to Sally's daughter and son on home care services, because it sounds like they might need some extra support, like from a nursing assistant. So I'll provide home care vendor informations from that for them to pick from, and also for her medications, I will talk to them about what pharmacy of choice they would like for Marta.
Okay.
I know you mentioned that she'll require the Hoyer, a wheelchair, probably a specialty mattress because of that
Yes.
healing wound, right?
Yes, yes.
So I would need to secure a vendor for her durable medical equipment. Depending on her insurance, there might be a little bit of out-of-pocket expense.
Okay.
So I'll run that through the insurance and see if they do have that, and notify the family of that, okay?
Okay.
One more thing, where I do have to send an update on the 5th. Do you think you will be able to complete all that education by the morning of the 5th, so I can send an update?
I think we can start it and see how it goes.
Okay.
And see if the
Yes.
family is receptive.
Okay.
Absolutely.
Yeah.
And I
Okay.
know let's see. So I think Sally is her official name, but she does go by Marta.
Okay.
And
Okay.
when we're communicating with her.
Okay, good to know. Good to know. Do you think maybe on the 5th, after we send an update, do you think we should have a family meeting with the family just to recap where we are, where we are with education, what things are left, what do they need to know or learn to ensure that they're very successful with Marta at home? Do you think we should do that?
I think it will be good because that way, we will do all the education by then. They'll have the information from you, and then this will be the last day when they have an opportunity to ask any questions for any of us, and we can just answer them right then and there. And maybe we can use an interpreter for that meeting as well, just so that we close the loop on anything.
Okay, great. So what I'll do is I will talk to Maria, who's Marta's social worker, okay? And then we can probably see, let me look at my calendar here. We can probably look at, how about we say we'll have Maria schedule a family meeting for February the 10th.
That's great.
At least that's early enough, close to discharge. By then, hopefully, we'll have completed all the education. We'll have a good idea about the equipment. We'll have the pharmacy in place. Oh, I did forget. I will also schedule her PCP appointment with that potential discharge date. And then based on our meeting on the 10th, we should hopefully target to get her home by the 13th. Sounds good?
Perfect.
Yeah.
All right. Well,
let's hope it all goes well.
I know. I think if we work on engaging the family, bringing the interpreter services, we should hopefully be successful and get Marta home based on her family
and
request.
Transportation, has she been already using transportation for any outside of
I'm
home?
actually not sure, but I think for discharge, it sounds like we will need to schedule an ambulance home.
I think so.
I think that would be the safest thing for her. I will put that on my insurance update on the 5th, just to confirm what company we'll use for that.
Sounds good. Perfect.
Okay.
All right. Well, thanks for having this meeting.
Oh, absolutely.
It's good to know we have a plan.
Yes.
Yeah, so once again, we will reconvene on the 10th with the family. I'll send an update on the 5th, and then we'll see what the next steps are, okay?
All right, sounds good.
All right, thank you, folks.
Yeah,
thank you. Have a great day.
No problem. Have a great day, everyone.
too.
I'm going to run up to my next appointment.
All right, take care.
Bye.
Bye.